Anorexia nervosa, an eating disorder. Imagine a person who looks into the mirror and does not see what other people see. Other people see the person as thin, even dangerously thin, but the person thinks that she is not thin but fat. Imagine a mind that treats food not as nourishment but as something to fear. Yes, they fear food. They fear eating. This is called as anorexia nervosa, one of the most serious and misunderstood psychological disorders. What is anorexia nervosa? Anorexia is a mental health disorder in which a person becomes intensely afraid of gaining weight. Because of this fear, they eat very little, often far less than their body needs. Over time, they become extremely underweight but still believe that they need to lose more weight. It is not simply dieting or wanting to be thin, it is a deep, overwhelming belief that their worth depends on controlling their weight, even when it harms them. What are the symptoms of anorexia nervosa? There are physical symptoms first. They appear because the body is not getting enough fuel. There is rapid and extreme weight loss, weakness and fatigue, hair thinning or falling out, feeling cold all the time, dry skin, slow heart rate, fainting or dizziness. And in women, it also causes loss of menstrual periods. Then there are psychological symptoms. These reflect how strongly the mind is trapped by the disorder. There is intense fear of gaining weight. There is a distorted body image where the person thinks that they are fat even when they are very thin. The person is obsessed with calories, food, and dieting. They are constant weighing or body checking and feeling guilty after eating, and they deny how serious the condition is. There are also behavioral symptoms or actions driven by fear. For example, eating very tiny portions of food, avoiding meals or making excuses, excessive exercise, cutting food into tiny pieces or moving it around the plate, and even wearing loose clothing to hide weight loss. Why does anorexia nervosa happen? Anorexia does not have one single cause. It is like a storm created by many winds blowing at once. There are psychological factors like low self esteem, perfectionism, feeling out of control in life, and even anxiety or depression. Then there are family or social pressures. Families that emphasize achievement or appearance, or teasing or bullying about weight, or a desire to fit into society's unrealistic beauty standards. There are also biological factors. Genetics may make some people more vulnerable to it. Then there is brain chemistry, especially serotonin and dopamine, that plays a role. Then there are stressful life events like breakups, trauma, changing schools or jobs, or loss of a loved one. All of them, genetic and environmental, are causes of anorexia. Often, anorexia becomes a coping mechanism. A person tries to gain control in a life that feels overwhelming. What are the consequences of anorexia? Anorexia is one of the deadliest psychiatric disorders because starvation affects every organ of the body. Heart becomes weak. There is a risk of heart failure, bone density loss, muscle wasting, kidney failure, infertility, low blood pressure, malnutrition, and organ damage could be physical consequences. Then there are emotional consequences like social withdrawal, depression, irritability, difficulty concentrating, extreme anxiety around food. And finally, there are life consequences like hospitalization or interrupted education or work, strained family relationships, and severe long term health problems. How is anorexia treated? Anorexia is treatable, but recovery takes time. It often requires a team approach. There could be medical treatment like stabilizing weight, managing the health complications, and even hospitalization if the condition is severe. And then there is psychological therapy like cognitive behavioral therapy, which helps challenge distorted thoughts about weight and control. There is family based therapy. especially effective for adolescents, and the person could be given therapy for trauma, anxiety, or depression if present. Working with a dietitian to restore healthy eating patterns is helpful. The patient needs to learn to trust food again. We need to slowly rebuild a positive relationship with eating. Then there are support systems like family involvement, support groups, and even compassionate caregivers. Recovery is possible. Thousands of people recover fully, but it requires patience, professional help, and emotional support. In simple words, anorexia is not vanity. It is not attention seeking. It is a serious illness of fear, control, and distorted self image. People with anorexia are not weak, they are fighting a powerful enemy inside their own mind. With understanding, therapy, and love, they can reclaim their lives. Thank you so much for listening.